Okay, today we're going to show how to put a Foley catheter into a patient's bladder. This is an indwelling catheter, and my patient's name is Miss Rogers. She has an order to have an indwelling catheter put in before she goes to surgery. And so before I put the catheter in, I'm going to ask Miss Rogers. Good afternoon, Miss Rogers. My name is Beth Klauber, and I'm your nurse for the afternoon. And the doctor has written an order for you to have an indwelling catheter put in your bladder before you go to surgery. And before we do anything, I first need to ask you, are you allergic to betadine, iodine, shellfish, or bananas? Because all of these have a linkage to having an allergy to betadine or iodine. And she says no, so we're good to go. If she did have an allergy, then we would get a different cleanser. So first of all, Miss Rogers, what I'm going to do is I've raised your bed up to a good working height, and it's going to take me a few minutes to set up. So I'm going to set up my materials, and then once we're ready, I will let you know. So I'm going to fold my covers to the foot of the bed, and I want them nice and smooth because I'm going to be working on the bed. And I'm going to drape her so that she doesn't feel exposed and that she stays warm. I'm using a draw sheet. You could use a bath blanket, you could use a flat sheet, but instead of putting this on the bed in a rectangle, I'm going to put it on in a diamond. So Ms. Rogers, I'm going to cover you up, and I'm going to give you this point of the covers. I'm going to let you hold that. I'm going to have second diamond over there. The third diamond is going to be towards the foot of the bed, and the fourth diamond is going to be towards me. And all you do is, she's got this amputation, so I'm going to take the diamond on that side and wrap it over that stump. Okay? The point at the end of the bed, I'm going to fold up to expose the perineal area. So I'll get her gown out of the way. And then the diamond near me, I'm going to cover this leg. Now, Miss Rogers, can you bend your knee and put your foot flat on the bed for me? There we go. So she should not feel exposed because she's covered. Now, I'm going to have to provide perineal care. Depending on how your kit is set up, you may need to provide perineal care by putting on clean gloves, soap, water, washcloth, and cleaning the perineal area. Same thing with the male patient. If you have a male patient, you do not drape the male patient this way because the penis is more anterior, so you wouldn't need to put the patient in a lithotomy or a frog leg position. Now I'm going to put on a pair of clean gloves. My kit actually has supplies to provide perineal care, so I'll demonstrate that as we go. When you open your bag, you're either going to have this white band to pull off, or the bag will be perforated. You really shouldn't have to mangle the bag in any way in getting supplies out. So I'm just going to pull that off, and I'm going to reach in, and I'm going to pull the kit out of the bag. In this kit, you have a lot of pages of information. I'm going to show you that in just a minute. But I'm going to take my bag, I'm going to use that as a trash bag. So I'm going to fold it over, make a cuff. And I like putting it right here where it's open so that I have easy access into that bag. Remember that this is not sterile because I've touched it with my gloved hands. This page just tells you the supplies that you have in the kit, tells you the size of the catheter. This sheet is a set of 4 different stickers. These stickers can really are accountability for saying who put the catheter in, when it was put in, because we don't want to leave the catheter in too long, and we want to make sure the patient doesn't get an infection. These can be peeled off and put in different areas. This one might go on the bag, but that's left up to the discretion of each individual unit. And then up underneath gives you the instructions if you forget how to put it in. When you open a kit, you always open the first fold away from you. And I'm going to open my kit down towards the foot of the bed so that I don't end up reaching over my sterile kit. So I'm going to take the first fold and open it away from me. Then I have two side flaps. And I'm going to open up. Now, the next thing on my kit is the drape that goes underneath the patient. Basically, this is just to protect the bed because when we start cleansing with the betadine can run down and we don't want it to soil your bed linens. So I'm going to pick it up. I'm only going to pick it up on one side. It has a shiny side and a dull side. Since my hands are contaminated, I'm going to pick it up by the dull side, step back, let it open up, and this upper side is sterile. So I'm going to get this up underneath my patient's hips. So I'm going to say, Ms. Rogers, can you please lift up your hips for me? And you want a good snug hold on that so that you can get it up underneath her. And we're going to get that up underneath. It doesn't have to look pretty. You just want it to protect the bed. Also, if my catheter were to bump that drape, it would not be contaminated since it's still sterile. Now I have my supplies for the perineal care. I have a set of 3 towelettes and then a hand sanitizer. So what I'm going to do is it has a little perforation. I'm going to open this up and pull out my little towelettes. Now I'm just going to set this on the bed right now so that I can reach in there. Ms. Rogers, I'm going to clean you before we get started. This is going to be a little bit cold and wet. I'm going to use my thumb and pointer finger, and I'm going to spread the labia, and I'm going to go by don't pee on me. If you can remember that, we're going to go distal, proximal, medial. So I'm going to go top to bottom, and then I'm going to throw that away. You see where that bag is? It's just perfectly situated. And I'm going to get the second one. I'm going to go top to bottom, proximal. Toss that one. And then get my third one. Go top to bottom, toss it. I'm going to toss that away. So good perineal care. Now I'm going to take off my clean gloves. Discard them. And I will tear open my cleaner, hand hygiene. Now I'm ready to go. So now I'm going to open the 4th flap, and we will now have our sterile field. The wonderful thing about a Foley catheter kit is it is set up in the order that you need to use the supplies. So it kind of tells you the steps we need to take. The advice I give to you is to touch everything in this top tray before you touch the patient. If you do that, it should go smoothly. So the next thing I have is my sterile gloves. So I'm going to take my sterile gloves. I'm going to put them over here on my over-the-bed table, and I'm going to put them on. These look just like the sterile gloves. They're not surgical gloves, but they are sterile, and they're set up just like our sterile gloves. So we're going to pinch the first one, step back, palm up. First glove on. Second glove, I'm going to scoop and hitchhike my thumb, step back, and put on the second glove. There we go, I have my sterile gloves. Now with my sterile gloves, I can touch anything on this kit within my sterile field. Remember that outer inch is considered contaminated. Now I have a top tray and a bottom tray. So I'm going to separate the two. Just make sure they stay on your sterile field. I'm now going to pick up this drape. This is called a fenestrated drape. The French word fenestra means window. So we have a little window here, and I'm going to make sure I don't contaminate my hands, and I'm going to put this over the perineal area. So now all of this surrounding area is sterile. Remember, I have to touch everything in my kit before I touch the patient, so it doesn't really matter what pattern you go in. This is a water-soluble lubricant, so I'm going to take the cap off of that. And then you can squirt this anywhere in your kit that you want to. So I'm putting that right there. And then I have my iodine swab sticks. Well, first of all, I'm going to remove, this is my little specimen container if I need a specimen once I get the catheter in. Here are my iodine swab sticks. You'll note that there's a little etch there and one there. So be real careful when you open these because this betadine can go everywhere. Now, you see how the swab sticks stick out of the top of the package. You can do one of two things. You could simply prop the swab sticks there and pull them out as you need them, or you could go ahead and remove all three and set them on your tray, which is what I'm going to choose to do. And discard that. Now, I still have one more thing I have to touch in my kit, and this is the syringe with sterile water that's used to inflate the balloon. So I'm going to reach in here and I'm going to grasp the end of my Foley. And I'm going to very gently guide this out. Don't pull it out rapidly, because if you do, this catheter can go flying around and can become contaminated. So remove the cap off of that syringe, and I'm just going to plug this in nice and snug. Once I do that, I'm going to put the end of my catheter tip into my water-soluble lubricant. Make sure it's going to stay there. Your catheter has to be happy where it is because we don't want it to flop out and contaminate. Okay, Ms. Rogers, we're ready to start the procedure. So I'm going to clean you first with the betadine swabs. It may be a little cold and wet. So you're going to use the same pattern that we did when we did the perineal care. So I'm going to spread the labia, and I'm going to get a good look, and I'm going to go top to bottom distally, drop that swab stick. Top to bottom proximal, get rid of that swab stick, and medial, top to bottom, and get rid of that swab stick. Make sure you keep this hand in place. If the labia are to close, then it becomes contaminated and you would have to start all over. Now I'm going to move my kit up a little closer. I can touch it on the sterile side. Now I'm ready to insert the catheter. In a female, the catheter is going to be inserted approximately 2 to 3 inches. Take a deep breath and bear down a little bit for me, Ms. Rogers. Going to go in 2 to 3 inches. As it's going in, I'm looking to see that I get urine coming back into the tubing. Once I do that, I'm going to go in 1 to 2 more inches. Okay? Once you do that, our sterile procedure is over. We're not finished, but the sterile component is finished. At this time, you do not want to let go of the catheter. If you let go of the catheter, it will slide out. So I'm going to take my hand that was holding the labia, and I'm going to grasp the catheter. And then I'm going to come down here, and I'm going to inflate the balloon. Once you inflate the balloon, make sure you keep that thumb on the plunger, because if you let go, then you can see that your sterile water starts coming back. So hold the thumb tightly on the end of the plunger, and then I'm going to give a gentle pull until I feel that balloon rest at the base of the bladder. And then I can take the syringe apart. At this time, you can take your fenestrated drape. This is a good thing to use to wipe up the excess betadine, although once we finish, you really need to get a nice warm wet washcloth to clean them up, get any excess betadine off. And then we're going to take our bag. Move this out of the way. Ms. Rogers, you're done super. And I'm going to attach the bag to the side of the bed on a non-moving part. You want to look for the hooks underneath the bed. And then you want to make sure that your tubing stays coiled on the bed. It's designed with that coil so that the urine will flow freely into the bag. If you get a loop of the tubing, the urine won't drain properly. Then we want to take our securement device. And it comes with some skin prep. It looks like an alcohol pad, but it's kind of like a second skin. And we don't want this tubing tugging on the patient. So what we do is we clean the leg with this skin prep. And then we take our securement device, and you can see a little Y port, a little Y there where these two catheters fit into it. And we're gonna put that there, snap it shut. Then you're gonna peel this off just like a Band-Aid. And you're gonna place that right where you did your skin prep. And you want to make sure that you have some slack in this so that if the patient turns over in bed, it won't pull on the catheter. And then I can get this taken out. I would dispose of all of my supplies, make my patient comfortable. There we go, Miss Rogers. We are finished with your catheter. And then we would pull her covers up.